So, good evening, everyone, and
Good
welcome
evening.
back to another episode of the Healthy Resets. That's the channel on YouTube. And this is what we're doing here. We are here tonight with our wonderful co-founder, Nurse Maria, Nurse Joseph, who is going to be chatting with us tonight about pap smears and breast exams and what's the importance of all of those. So, we're gonna dive into this very important topic to women. You'll see me. Now this is a part of this is gonna be a Q&A session. So if you have questions, please bring them. In fact, I implore you to find questions and come and ask them of Maria. This is your opportunity to get us on, to get her to answer some of your inquiries about pap smears and breast examinations. I'm gonna ask you questions throughout to give you an idea. We'll try to keep it simple so that you get a good understanding of what's going on here. We're not going to get too deep into the medical jargon and so on. So thank you for joining us and welcome back to another episode of the Healthy Reset. So Nurse Maria, share a little bit about yourself to the persons who are meeting you for the first times or those who've forgotten who you are. I would love to get to know you a little better.
Okay, good night, everyone. And we want to welcome everyone to our White Rose channel, where we deal with a lot of women issues, timely issues, health issues, and we deal with a lot of the questions. I am Maria Nurse Joseph. I'm a registered nurse. I'm a midwife. I'm a sexual health and also a reproductive nurse. And my job generally every day at this time is to help women to become more aware of their health through education. And one of the things I do is make myself available as a nurse who does pap smears and breast exams and help women educationally through counseling and education and through referrals when and if necessary. So that is one of the main things I do at this stage of my career as a nurse, midwife, pap smear, sexual health nurse. But before we go into the full topic, which this topic is actually a very large topic, I want to give you all an overview, a short overview of, through the World Health Organization unit, information that I found online to let you all know the importance or how serious or how prevalent cervical cancer is worldwide. So globally, cervical cancer is the 4th most common cancer in women, with about 600,000 new cases found in 2022. In the same year, about 94%, which accounted to about 350,000 deaths, were caused by cervical cancer, ladies and gentlemen. The highest rates of cervical cancer incidence and mortality are in the sub-Saharan and African, Central America, Southeast Asia areas. The main cause of cervical cancer is a commonly sexually transmitted infection, which can affect the skin, the genitals, the throat, the cervical area of males and female. Almost all sexually active people will be infected at some point in their life, usually without symptoms. So the HPV virus is the culprit, is the main culprit here of cervical cancer. But what cause the infection actually? Persistent infection of the cervix, which is the lower part of the womb, which opens into the vagina, also called the birth canal, if left untreated, causes 95% of all cervical cancer. It takes typically 15 to 20 years for abnormal cells to become totally cancerous. Now, if it's left untreated and if an individual or individuals are immunocompromised, it will make the disease progress even faster. So hence the reason why we are here to help, as the older generation would say, prevention is better than cure. So we would like that a lot of us, it is prevented, and if not, it is found in the early stages and dealt with efficiently and quickly as possible, because it is a very savable cancer once found quickly. So one of the things that can be done in terms of prevention is being vaccinated at age 9 to 14 years, which is the most highly effective way to prevent the HPV infection. And the HPV vaccine can be given to both boys, girls, males, and female from the age of 9 to up to the age of 26 to 27 years. So males and females can have the vaccine.
I'm gonna
So
jump in here real quick and add, I know we've been saying males and females, but in this
yeah,
changing world of
yes,
LGBTQ plus, that involves everybody.
everybody.
So whether you're non-binary, or you are somewhere in that LGBTQ spectrum, everyone can have pap smears. So there's no, let's not create any confusion there of who is eligible and who should do it. Sorry, Maria, you're on again.
Okay. So why it is good, we want to start very young, it is important to try to catch the younger generation even before they become sexually active, so that they are protected even before they start to become sexually active. It is presently, it is given by 1 or 2 doses 6 months apart.
So Maria, I'd like to bring it back to the women we're talking to and the persons
Yeah.
in this community.
Yes.
What about for this community? Can they get the HPV vaccination now? Would it have an impact? What do you say to that? So just going into menopause.
Previously, when we gave the vaccine, it used to be from the age of 11 to 45. But new update has shown me during this last year in the vaccination, it's given now from the age of 9 to about 27 years, both males and females. Right?
So would you recommend anybody in this room to get HPV vaccine at this age, or if you're in your 40s, 50s?
Well, from the new research that has been gained through this year, it's up to the age of 27 right now until I get more information to back up this new research. But up to a year before, it was as far as I knew, it was up to the age of 45, because it is preventative, or what we call prophylactic vaccination.
So I'm gonna toss in a little bit about my medical knowledge into that and say if you are sexually active, and there's not much, the research hasn't been going beyond the age of 45 and so on, as mentioned here, and they're focusing on the more active, younger individuals. But we have an interesting dynamic in our world today where we're seeing a rise in sexually transmitted diseases or sexually transmitted infections, STIs, in the older population, 65, 70 years old. We have a rise in things like gonorrhea, syphilis, and so on. And it's mostly because of the advent of these new drugs like Viagra and Cialis, which is allowing for that activity to become more prevalent in both males and females, and for just about the entire older population. So I would say protect yourself. I mean, talk to your doctor and have them advise you. Go into your gynecologist and have them advise you, since the research doesn't go that deep into the older population. But I'm sure in the next few years, we're going to see a lot more research coming out for the older populations. It's just that the focus is not there yet. Or it probably is there already, it's just they haven't brought out any data to confirm or deny. So at this point in time, that's still a question that's left up in the air. And we're not trying to confuse anybody, but we still recommend that if that's the case, go in, talk to your gynecologist. We will try to advise you more as we learn more on this topic. It's very, very, very important topic. And hopefully be able to give you some good advice moving into the future as we keep abreast of what the research is showing and what the new common guidelines are going to be. All right. So, any questions so far? No? So, Maria, sorry, carry on, Maria.
Okay, so generally speaking, we in Trinidad and Tobago, we advise that women do a pap smear once they have a history of doing pap smears every 3 years, and they themselves never had cervical cancer. Once their results consistently come back normal, they can do one every 3 years, right? If they previously had cancer, some women, they had it and they had hysterectomies, or it's prevalent in their families, or some women, they are so much concerned about it, they want to come and do it on a yearly basis. With people who are more high risk, we suggest that they come and they do it on a yearly basis. But generally, it's every 3 years that you come in and screen to check to make sure that you are not, you don't have the HPV virus, or that you do not have cancer. And why it's important that you come and you do it on a regular basis or on a timely basis is that, just as I said before, it is very doable. Now, I'm not trying to get anyone afraid, but I had an incident recently. One of my clients that she had never done a pap smear in her life, right? And she is actually in her 40s now, and her test, when I was doing the pap smear and I saw what was happening, I realized that she was very urgent because the cervix wasn't looking healthy, and the main reason why she didn't come in all those years prior is because she was afraid. She was afraid of what she heard, that the test would be uncomfortable, it would be painful. She listened to a lot of other people, and she started to have recently, not even recently, from what she told me, within a last year, she started to have a regular, consistent lower abdominal pain during and after sex, which are signs of possible cervical cancer. She was having, her tummy was becoming distended, and she had different issues that the doctor had to send her to have one done. So, ladies, it is really very real, and it is something that we should take very seriously. What I suggest that we educate ourselves, and we come in and talk to those who are educated in doing the test, so that they could properly inform you and help you go through the procedure very, very professionally and painlessly as possible so that you can have it done, because it is a very savable cancer.
So Maria, a quick question. Could you describe for us a little bit about what the procedure is like?
Okay, so the type of pap smears we do is what we call dry pap smears. We have the dry pap smears in the public sector, and then privately you would find more of the dry and the wet. Now, the dry pap smears, what it actually means is that when you're coming to do a pap smear with the region that we have, you cannot have any other sexual activity within 48 hours prior to having the test done, and I'll explain that. No, you're checking for your cycle 10 days before or 10 days after. You can come in and have your pap smear as well. You're ensuring that you're not doing any type of douching, because that will wash away the cells, the natural flora in your vagina. So what the blood and the sperms would do, it would hide the cells, or occlude, as we say, the cells from being seen. So hence the reason why we say no sexual activity 48 hours before, and you're coming 10 days before, 10 days after the period, because the blood or the sperm would hide the cells. So you're coming in. Those are the criteria to have it done. When you come in, we do a form to get a history and to talk with you and find out what issues you have through the form. Then we explain to the patient actually what we are going to do. Then when we are going through the procedure with them, I make my patients get very comfortable with the speculums and speak to them very slowly and make the procedure very, very, very comfortable as possible, so that we can get the best results with the examination.
So can you tell us a little bit about the procedure itself, the speculum, and if I made to understand there's a small brush and a spatula,
Yes.
and what's the
Yes.
difference between the dry and the wet one? Is
All
there
right.
any chemicals involved? What is all of that?
What I explained to you just now was the procedure for the dry one. For the wet one, it does not matter if you were sexually active before the procedure. It doesn't matter if you are on your period. That is a stronger reagent, and it will pick up the cells still, right? So it can be performed with the wet one very easily, because it doesn't have the restrictions of the dry one. How we get to the cervix is we introduce a speculum very gently. We have various sizes, basically the small, medium, and large, and we make the patients as comfortable as possible. So we gauge our patients according to their age, their height, and we use one accordingly. If they are in any way uncomfortable, we discard what we use, because they are disposable, plastic. And before we even insert it, we put gel on the speculum to make it easily inserted. Make our patients very comfortable on the examination bed, and step by step, we tell our patients what we are doing so that they can understand and feel comfortable during the procedure. Well, what we do as well, we take samples with what we call a spatula, which looks like what we call a lolly stick, like long time when you see the lolly man and the stick that the lolly used to be on. It's similar material, and it has two sides, one shaped like a heart and the curved side. The curved side, we take samples from your secretions through the vaginal walls after we insert the speculum. Then we turn it on the next side, and we take it from the endocervical area, which is the outer part of the cervix, and we smear these two on the glass. And then we discard that, and then there's the brush, very, very, very small, that is made to fit into the cervical os. We insert into the area we call the transformational zone, where we pick up a lot of the cancers that may be in the very earliest stages, and we smear the glass with that. That is sprayed with something called a cytology spray, and placed on the glass and sent eventually to the lab to be screened and to come back with the results. Yes, so that is basically how it looks. So you're seeing the brush there and the spatula, very, very light, gentle movements. This should be done. And what I tell ladies, if you're going to anybody to do a pap smear and they are rough, because a lot of women come and say that, you know, they had some bad experiences. Well, what I suggest, ladies and gentlemen, if somebody's being it's rough, you're telling them it's not comfortable, I think you should stop that procedure and find a provider that is very gentle and caring, so that you could have a very comfortable experience. And why that is important, many ladies and gentlemen who do pap smears and have a horrible experience, it takes them years to return to have a pap smear done. And that could be life-threatening. So I would suggest you find a healthcare provider who does pap smears and makes it comfortable for you, so that you guys have a good relationship, and you can ask to, you want to be comfortable to ask them any question that or queries that you may have as well. That is very important.
So my understanding is the difference between the dry and the wet is the spray they use to fix the cells to the slides, right?
No, no. The difference between it is the type, the regions they use. The region that they use for the wet,
And the reagents
smear,
are going.
the different
reagents are being used for what? Is that is going to be used in the vagina or in the cervix, or is that something that goes
that is
on
something, from what I've seen with the wet, right? The solution, it's stronger. So it doesn't matter if you are seeing your monthlies, if you might be inflamed, sometimes the results come back with a lot of inflammation. If there's sperm through recent sexual activity, the wet one will pick it up. If you're doing the dry pap smear that I explained before, it will not pick up the cells if you are having your monthlies, or if you are sexually active, or if you have inflammation. It will not pick up the cell because it will not see it, because of these things. They obscure or hide the cells. So that's the main difference between the dry and the wet.
So to answer what I was trying to get at everyone who's here, was that this drying and wet part is something that happens after the pap smear has been performed. So after you do the procedure, this is all part of the prep for getting the cells properly set, so that you can examine, that the lab can examine them and make a better confirmatory diagnosis. Right. So yeah, so sorry, Maria. Yeah, I just don't want anybody to get confused and think this is a
Yes, no problem.
chemical. Yeah, I didn't want
Yeah.
anybody to get confused and think
Yeah.
this is a chemical
Yeah,
that
that
goes
chemical does not
into,
go up inside of you.
yes,
No.
into the vagina. This
Right.
happens after the pap smear is
Yes,
over.
that,
And
yes.
that procedure is just for making sure that, and to be clear, why it's called dry, it air dries,
Yes.
right? And that's why the things like sperm and gels and blood can cause a problem with hiding the cells, because the cells air dry on top of the cells of the cervix, and that makes it hard to see under the microscope and to stain, and it can give a false, what's called a false negative, right? That means that you have to repeat the procedure, right? And it decreases the accuracy of the pap smear. So one of the questions that came up when I was doing my research was, is this a painful procedure?
It can be according to the provider that you have, if the gentleness of that individual. Two, it can be a bit more painful for women who are going through menopause. Why? Because the lining, due to the decrease in estrogen and progesterone, the lining in the vaginal area becomes thin. And another thing that happens to women during this time, during peri or and post, is that you have less secretions and it becomes very dry in the vaginal area. So extra care is needed when dealing with perimenopausal, postmenopausal ladies, right? So that is one of the effects or side effects, like we can call it that, during perimenopause and postmenopausal area time. It can be a bit more discomforting than a younger patient who is more moisturized. Hence the reason why you use be more gentle, and you can use a bit more lubrication, a bit more of the lube to help during cases like that.
So, all right, so what if you get an abnormal result? What does that mean? Does that mean you have cancer?
It could mean, generally, if you get the results and it says abnormal, what we do is refer the patients almost immediately to have the patient be seen by the gynecologist, right? So that result doesn't necessarily mean it's cancerous, but it could be pre-cancerous cells coming into play, and they want to deal with that as immediate as it possible. So it would be referred by me, or who other health professional may be seeing them, and they have different procedures to do. They'll do what we call a biopsy of the cervix, where we highlight that area through the use of acetic acid, which allows that area that looks suspect to highlight white, and the doctor goes in and takes pieces of that, and we put it in a solution that we call formal saline, and send it to the lab to check to see if there's any concern, if those cells could be possibly cancerous. And if so, they would start a course of treatment to help according to the stage that they are at that point in time, which is, if it's that very early stage, it is very, 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 very savable.
So what if kind of infection cause an abnormal pap smear?
Yes, if you are infected, you have the trichomonas infection, which would show up in a pap smear. If you have HPV, that could show up as well and cause you to have an unusual result coming back. And the HPV we know that there are certain types that cause cancer. Not all HPV viruses are cancer causing. There's a certain number of them that can cause cancer, and there are a certain number that can cause other things like genital warts as well. So that test also picks up for the HPV virus, which is the main culprit for causing cervical cancer.
So there's a scary question that you mentioned earlier. What if it comes back abnormal? Is it cancerous? Can you go into some of the other changes and why pap smears are probably the most effective cancer preventing tool in women of any cancer that exists in the world today? It's a one investigation that can actually to be highly effective in removing any potential precancerous cells. So what are the precancerous cells then?
All right, so what is important here is the screening, right? So when we do the screening and we find unusual looking cells, we come and we do the biopsy and we see the stage that it may be at that point in time. There are different types of procedures that can be done. Yes, you call something called a cone biopsy, which cut out a larger piece of that area. Where we do that in the surgical area, many times in the surgical area, and we cut out the large pieces or the large infected areas to get to at most of the cancer or all the cancer, catch all the areas that are looking unusual where the cells are highlighted. You call that a cone, then you have the lets where you carry in the theater and they take out even larger pieces and get the cancer going and if it's probably deeper into the tissues to get the cancer out of the area, and they give you medication and treatment accordingly. So generally, and to get to the cancer that may be in a deeper in the tissues to manage that patient. So generally they would be managed and reviewed by the gynecologist to get best practice and to get quick results. So the reason why I was saying earlier that these tests and screenings are important is because it catches cancer at a stage where it can be dealt with effectively and women can go on to live normal lives. And just they come in generally after just to get continued reviews, but it doesn't get to metastasize and goes to the organs or different other body parts. So the earlier that's why we say the screening is very important. The earlier we get to have to the cancer and to refine the cancer, the more effective the treatments are. So it is important that we pass on the word and let a lot of women know. From the time you hear the word cancer, a lot of people say, well, that's it, I'm dead, I'm a goner. But it is a very treatable cancer, and screening is vital here.
So I'd like to add a little bit to that. So what the screening does is basically there's several precursors before it goes to cervical cancer. And what that means is that the gynecologist can go in and remove those little areas of where there's potential for cancerous growth. And once they remove it, it takes away all problems of developing cancer, right? And you're pretty much cured. And then the follow-up screenings just make sure that nothing else comes back, they didn't miss anything. And doing that allows you to, that's why this is one of the only cancer that can be detected extremely early, treated very quickly by just cutting out the area that's damaged or freezing it and removing it. And the woman is cured. You're back to being normal, right? And all you have to do is follow up with pap smears the next year. Once you have a certain amount of pap smears that are clear, then you go to the 3-yearly follow-up as usual, right? So I wanna reach out now and say, does anybody in the community have any questions that I'd like to ask at this point of Nurse Maria about pap smears or anything to do with pap smears, the procedures or anything like that? Put your hand
Yes.
up if you. Yes, sure. Go ahead.
Elizabeth here. Good night, everyone. Last week, I think Dr. Khan mentioned about a opening of a clinic. Will this be one of the services that you all will be offering in the clinic?
Yes, and I know you, and that's the announcement we're gonna make at the end of this session about the clinic and what we're offering and everything. And yes, we will be. Yes, certainly.
Thank you.
You're welcome.
Anybody have any other questions? Just unmute yourself and ask, or put your hand up for me, or just post it in the chat if you want to. Right.
All right. What I
So,
would like to say though, at this point, before we go into the breast exams, there are signs that you may probably look out for anything that may be unusual, that could be query, give you the suspect, that make you might be suspect that something is wrong, right? So there are certain symptoms that you should look at as women. Women should see a healthcare professional if they notice unusual bleeding between periods, right? Your periods have stopped and you're still having heavy bleeding. After menopause, when that bleeding is supposed to be over, you're still having bouts of bleed. That is a cause of concern as well. And after sexual intercourse, you're having bleeding. That is a cause of concern. Another symptom is increased or foul smelling vaginal discharge, persistent or lower back, legs, and pelvic pain, also weight loss, fatigue, and a loss of appetite, vaginal discomfort, and swelling in the legs. All of these generally together, or it could be separated, symptoms can be a cause of concern, particularly if you know you are someone who never had a pap smear done before. You should have that checked as soon as possible.
excellent. So if there are no more questions, and you can ask questions throughout this session, if anything comes to mind. So we'd like to move on to our next topic of discussion for this evening, and we're lumping these two together. We usually don't do it this way, but these two are very important examinations and tests that all women should be very versed in. So the second one we want to dive into is breast examinations. So let's dive into what are the breast examinations? Why do you need them? So let's start with what are they?
Breast examinations are very important, and why we encourage women to do breast examinations on a regular basis, meaning that monthly, 3 to 5 days after your monthlies. So we implore women that they do it monthly, 3 to 5 days. During, as people say, as your period starts, you start to count about 3 to 5 days after, because you don't want to do it during the period, because you at that point in time, your body has more fluid and your breast would be that is not the best time to check your breast because of the extra fluids that you would have. So when that has resided or reduced, wait until a few days, 3 to 5 days after your period, and then you check your breasts. Now, why you have to do that as well, you want to get comfortable with how your breast feels, and you would know, once you're doing it on a regular basis, you would know when something feels odd or strange. Now, usual breast tissue feels more spongy like, right? So you know how generally your breast would feel. So if you're checking your breast on a regular basis, you would know what was normal. And when something abnormals come, for example, if you get you feel a lump, and that lump is harder and more rigid than the normal lump of tissue, I should say, you feel in your breast. Some women have what we call fibrocystic breast, and so that is naturally a more lumpy type of breast. But this lump we're talking about, it may accompany pain, it may be painful or painless. But it is important to know that most lumps in the breast are non-cancerous, but there are those, every lump what we say is suspect. So you want to make sure that that lump that you're checking is not abnormal. So what I usually teach my patients, you can check. What you want to look at is inspect your breasts. So you stand up in front of your mirror, bend forward, and you look to see how your breasts are falling. Just looking to see if one is coming down a little further down than the other. If you're looking at the texture of your breast, if it has that orange peel, you know how an orange peel looks with those large pores, and it looks lumpy on the outer part. All of that is a sign. When you squeeze your nipple area, you're getting unusual looking discharge. Could be bloody, it may be smelly. All of those are signs, are possible, something unusual that may be happening along with that possible lump that you may be feeling, or it could be multiple lumps that you may feel. And when you're starting to do a check your breast, you always start under the armpit, which is the tail end of the breast. So you make move, you make it, you raise the arm up and you start under your armpits and you come around until you reach to the breast area, nipple itself. Right, so you're seeing a clear picture there of and how you want to do your breast exam manually. So when we do a breast exam with our patients, what another thing you can do as well, you can put your arms down while you're in the mirror, and then you can stand up straight and you're checking to see how your breasts look, how they fall. Now, there are, in some cases, you would see the skin changes on the outside, which is, you didn't get as, it looks unnatural. It looks like, I've seen it before, it looks like something, like the skin to the outer, your normal shade of your skin has gone and you've seen a pinkish raised area. That is an area that may be a cause of concern. You get that looked at as well. So you're looking, you have to inspect that. If you see the picture there where the lady is checking around the breast areas, you're coming around from there and you're using the fingertips and you're making rounded movements and coming around. So what I always tell ladies to look at your breast as a clock. There is 12 o'clock on the top, the bottom is 6, then you have 3 o'clock and 9 o'clock. So you take note when you do your self check, and if you find anything unusual and the doctor asks you, well, what did you feel and where did you feel it? Well, you could say, I felt it at 1 o'clock. I felt an unusual lump at 1. And he said, did you feel any other lump? He said, you can say, well, I felt an unusual lump at 9 o'clock. So you could describe where in the breast area itself that the lump was being felt. Now, note lumps can be as small as the size of a pea or as large as a golf ball. So when you're checking, it can be from extremely small to extremely large. And so those are the main ways you can check your breast very simply to know if it is something is going wrong.
So, one of the things I want to mention is if you have a partner, your husband or your partner as a whole, they can also help with the breast examination. Remember, your partner might know your breast as well as you do.
Yes, that's important. True.
And you can also ask, do you think this looks unusual? And if the person says yes, we implore you, come into our clinic. Let's take a look at it for you. Nurse Maria is excellent at this. This is where all of our experience exists. And she can give you some good feedback and we'll get you into a right state and to the correct specialist so that you can be treated as quickly as possible. Right? So we covered what you should do and how to do the breast examination. how, no, the question asked for Nurse Maria is how often should you get that clinical breast examination? Somebody like coming into the White Rose Community's clinic, how often should you do that?
What we tell ladies, they can come and do a breast exam roughly every clinically, beside doing your own breast exam, roughly around every 6 months, just to ensure everything is all right. And what we recommend as well, that women, they do a mammogram at least every 2 years, especially when they reach age 50 plus. It is important. You do a mammogram and you do the breast ultrasound, which would help to see any unusual changes within the breast tissue.
Also, I'd like to recommend that if you have a strong family history of breast cancer, right, definitely do a mammogram. So if you have a grandparents, great grandparents, you know a history of breast cancer in your family, definitely come, let's do your breast examination for you and organize the mammogram. Reason is, it's been proven that is a strong familial genetic makeup for breast cancers in women, and it can be passed on from one family, and it does move on from one family to member to the other. So I don't know if you've ever heard of multiple women in a family getting breast cancer, and it's because of that genetic makeup. So definitely not just waiting until you're 50 years old, but you have a strong family history earlier. Start when you're 30. The younger women in your family, encourage them to come in and start doing the breast examinations also. The earlier you start, the better. It's much like colon cancer. It does have a strong family history, so we always recommend starting as early as possible. Not only with your own breast examinations, but getting the clinical breast examinations done by the professionals like those in our clinic. All right, so that covers, yes, Kristen, you have a question.
Hi, good night, everyone.
Good night.
Is it necessary to take a pap smear after doing a hysterectomy for cervical cancer? Is it necessary? And if it is, how long or how regular do you get a follow-up if it's necessary?
Very good question. Now, I've always said the pap smear is the gold card to prevent cancer. Now, particularly in a case where a woman has had cervical cancer, she has the vault of the cervix that remains there, and you don't know what could be happening there still. There may be cells that they didn't get when they took the uterus out. So what I would suggest that you come in and you do it on a regular basis. Still, every 3 years, and in some cases, according to your doctor may tell you, come in a little more regular, probably every year, just to ensure that there's nothing cancerous that may be there. Come in and do it on a regular basis. Like, so you could come in like every year. I've known patients who've had hysterectomies and they come in to me every year just to ensure, especially as Dr. Khan was saying earlier on, if you have a strong familial history, or if you yourself have had a cancer, come and do it. Come in and do it.
Thank
And
you.
to add to that, that involves any form of cancer. So if you had colon cancer, they removed the polyps and you had some chemo, you had breast cancer, any history of cancer involves here. So that means you're at risk of other forms of cancer and it could be missed. So definitely come in for both your breast examinations and your pap smears. So are there any other questions?
Another question, please.
Of course, sorry.
Sure.
Well, I have had a lump in the right breast, right? And but I've been to the doctor for it, and she said that it's a milk lump, right?
Okay.
But I was put on evening primrose oil, And when I'm not taking the evening primrose oil, if I haven't taken it for a while, what happens is like this lump gets inflamed and it is very painful. It also causes, is on the right side, it also causes like glands running behind the right ear, which is also very painful once I'm not on that evening primrose oil. And sometimes the breast feels very, very stiff. So could you give me some insight on that?
I don't know much about that type of milk lump, right? But have you ever done a biopsy? Have your doctor ever done a biopsy on that lump?
No, they haven't. And do you think it's necessary to have a second opinion on that?
Yes, I think so. I think you should have it checked. Any lump in the breast to me, especially consistent like that, is to me concerning. And if it's causing you that kind of discomfort, it's just, I mean, check it out. It wouldn't hurt.
Yeah, I would actually recommend a second opinion also. And having the second, even a third opinion.
Mhm.
Just to get a different point of views because different doctors have different ideas on some things sometimes. So not all of us think alike. So definitely I'd say get a second opinion and consider, asking if they consider a biopsy on it. Especially when you're not on the symptoms and on the primrose, you're getting pain in other places. That's a little unusual, or at least I find it to be a little unusual.
Thank you.
So, but honestly, come to us. So let's Nurse Maria could take a look and see and give you a bit more information. Have you done the mammogram or ultrasound on it either?
No, I haven't. I just took
Okay.
her advice. That was many years ago, and I'm really struggling with it.
Well, you
Okay,
need to
all
follow
right.
up. You definitely need
Yeah,
follow up on that.
well, come to us and let's take a look, see. And we'll see what you can recommend and get you onto a second gynecologist. Now, not knocking your gynecologist at all. They may be correct, but it's always, good to have a second opinion sometimes. And we're not offended by it as doctors. We actually find it very useful when a patient does that. Or at least from my point of view, I find it useful. Are there any other questions?
Yes,
Kristen?
one quick one, Dr. Khan and Nurse Maria.
Mhm.
I would like to find out the woman who has lived all her life without doing a pap smear, and she has reached the age of 65 years to 70 years. What, in your opinion, what do you think? Should she do a pap smear at that age? Should she be concerned to have one done, at least to see what's going on there? Or she shouldn't be concerned at all because she doesn't have a medical problem? Thank you.
You're welcome. She should have one done, right? I've had ladies who've never done one because remember, there's a certain age group that didn't have the knowledge or the education that the younger generation are having now. And a lot of them didn't know what even a proper breast exam is and the importance of doing one. So there are those who will, as I would say, missed out on regular screening. And if they reach that age and they haven't done one, they should come in and have one done just to make sure
Thank you.
everything. Yes.
It's also based on the fact that area is constantly changing. As your hormone levels change, as you grow older, as your diet, your nutrition changes, all of that can affect those changes. There's something called epigenetics that states that your genome, your genetic makeup is constantly changing, and it changes over generations. It doesn't change just in hundreds of years. So, for instance, an example of this is obesity in families. Within 3 generations, obesity can become a genetic code in a family, right? And again, you could also take it out, and that's how flexible epigenetics is. Right, and this is a very recent discovery within the last 10 to 15 years of medicine that epigenetics is becoming more and more prevalent, and we're understanding more about it. So, it's a constantly changing area, and I recommend it at any age. Because as you grow older, as these changes occur, the different things can happen. And society has a different impact. I mean, things like, we don't even know if climate change or, the type of chemicals we use today are affecting our ability to stave off things like cancer and so on. So definitely recommend it.
Thank you.
Are there any other questions? So if there are no more questions, let me just check the chat first to make sure that I didn't miss any. Well, if there aren't any more questions, the first thing I'd like to say, I will close off tonight by saying thank you, Nurse Maria. Your presentation on pap smears and breast examination is absolutely very informative. And I hope everyone here took away something from that and feel motivated to take action on getting your breast examination and your pap smears done. The announcement we wanted to make, what I was said earlier, was say stick around here, is that we are opening the clinic. We plan to open it starting from the first week in July. If we can't do the first week, by the second week in July, we should be up. Our soft opening is the first week in July. And as a present for opening the clinic, we're offering the pap smears and breast examinations as one of our first services. What we'd like to offer the women in this group, and we can't offer everybody, so the first 10 women to come join our clinic, you'll have your pap smears done and a free breast examination, right? So we're offering that to the first 10 women to join our clinic. We'll post all of this in the chat groups in WhatsApp. So if you haven't joined WhatsApp, here is the link for joining. Let me post it again. In WhatsApp group, you'll get information about what is happening in the community. If you're listening on YouTube Live, I'll post this link in there also. Sorry, I just lost my. Right. And of course, you could find us on YouTube Live. So if you want to watch over any of these videos, you can. So I'm posting that also. Right, so as I said before, we'll put up the booking schedule. If by the end of this week, if not the end of the week, by the beginning of next week, you'll have the booking schedule. Come book your appointment. As I said, the first 10 women to book their appointments will have their pap smears done and have a breast examination for free. And then as we progress, we want to do more and more of this stuff here. So we're looking forward to having you in our clinic, and we have bringing a lot of things into the clinic so that we can really support women and help you to navigate menopause with ease and thrive through the change. That's it for tonight. I will toss it out there. Any other questions anybody has?
Hi, Zainul.
Hi, dear Rani.
I just wanted to find out something. Maria said she was talking about like changes in the breast, like the orange skin, looking skin, and the abnormalities. But I had a client who just felt a lump, and when she went to check it out, she had absolutely no abnormalities. Everything was normal. And she just felt a lump. And when she went and checked it out, she had stage 3 breast cancer. So I'm wondering if it is that these things show up at later or earlier, because she had absolutely no signs of this cancer.
So to answer that, the skin changes that occur can
Nothing. She had
depend.
nothing
Yeah,
because I
but
asked her.
yeah, the skin changes that Maria was talking about, those vary quite significantly depending on the type of cancer and how aggressive it is and so on. Some women, like your client, will have just a lump and may not have any skin changes at all. And as you said, the diagnosis is stage 3. And sometimes, especially if the cancer, if women with larger breasts and the lump is closer to the skin, then it will pull at the skin. And that will see changes, but sometimes it's not that close, it's deeper into the breast. And it may not have gotten to the point where it is affecting the skin. So it varies quite significantly. So that's why I always say doing a professional breast examination, coming in for a clinical breast examination, the mammogram is so vitally important. In addition to doing your regular own breast examinations, so that you can pick up on this early and bring it in, right? So all of it has to go together. Maria, do you have any more to add to that?
Yeah, I agree. I'm in very much in agreement with that. Not every characteristic would be, or not all breast cancer will manifest in a similar or usual way, right? So as Dr. Khan said, they go along one with another. As he said, hers was apparently deeper into the tissue and wasn't showing the typical signs and symptoms. She probably didn't have even a discharge from the nipple, Ms. Diona, right? She had a discharge or anything from the nipple?
No, she didn't.
Right. So
Absolutely no symptoms.
nothing at all, right? So,
Nothing.
and did she had she ever done any type of mammogram on a regular basis within 2 years of
No,
that diagnosis?
no,
Mm,
no.
okay. So you see where these tests come in handy.
Yeah.
It would pick up
Mhm.
things that even the manual exam that we do would not pick up. So that is why we refer you to have mammograms, the ultrasound or mammogram at least every 2 years, especially at a certain age group, to pick up those that may be hiding. So it's
Okay,
very
and
important.
also, so if you
Mhm.
are doing a mammogram and an ultrasound on a yearly basis, do you still need to do your own breast examination at home?
Yes, I encourage it. You see, the cancer has, as Dr. Khan was saying, sometimes it's in the environment you're in, right? It may not be showing its face. It might be very, not be able to pick it up. It could be a time in your life when you probably had a lot of losses and your body is stressed out and it pops up. You don't know. You understand? So you have to keep your hand on the pulse because stress brings a lot of sickness to your system, right? And these days we're living in very stressful times. So the more we can do to prevent by a simple self-breast examination on a monthly basis, it can save your life.
Right.
Plus, in addition to that, remember, you know your breast better than anybody else. You and your partner. So you will pick up on changes faster than the doctor or the clinical examination. Sometimes doctor hasn't seen you in 2 years and you come in and we don't take pictures and have it in your file of what your breast looked like this last time they came in. That's a violation of your rights. So, I mean, we can with your permission, but majority of times you are around it the most. So you will pick up on those changes really quickly. And then you could be able to activate and say, okay, let me go to my doctor and get this checked out. And it gets it moving really fast. Remember, some of these cancers can be extremely aggressive. And that's what we're trying to avoid. Some are very slow, but then some are very aggressive, and that's what we're trying to avoid. So you're doing the once a month examinations helps to catch things at those early stages where things can be done. Rapid treatment can be involved, and we can get a cure in place to have you in remission. Well, ladies,
Wow.
if there are no more questions, we're gonna close off tonight with this very informative discussion. Hopefully you got something from this, but we also want to implore you to don't just listen and take the information, but to activate and come in and see us. Let's get you your breast examinations and your pap smear done, get you registered in a clinic so we can keep a good record and track of you and get you on the right path to a healthy outcome, right? and really get things rolling for you so you can be good going into the future. All right, that's it for tonight. Thank you all for joining us on the Healthy Reset. We hope to have you again next week, 7 p.m., where we will post what the topic is next week. And next week's topic is a Q&A. So bring your questions and answers. Bring your questions to the next topic. We want to learn what you want to know about menopause and what ideas you will come with that you would like us to implement to help you to navigate menopause. So bring your questions next week. We'll do a Q&A, and we'll bring our questions, you bring yours, and we'll try to see if we can build something that's very impressive that helps everyone. Thank you all. Have a great evening, and we'll see you next week, 7 p.m. on the Healthy Reset.
Good night, everyone.
Bye-bye.
For
Have a
coming.
good evening. Have a safe night.
Good night. Special welcome.